Thank you very much. I'm Joe Lawler. I'm with the Gaudreau Group, and welcome to our webinar. Here at the Gaudreau Group, we consult with our clients to maximize the value of their employee benefit plans in the most cost-effective manner. Today, I want to introduce you to a new strategy which we think can positively impact your benefit program for both your employees and for you. I want to tell you how it works, let you know how you can get more information specific to your organization, and answer any questions that folks might have. At the Gaudreau Group, we're fortunate to have some really great clients who want to provide the best benefit programs they can, but like everyone, they're challenged by increasing costs and complexity in today's programs. My colleagues and I, can somebody mute their phone? Somebody? I'm hearing a lot of air. Okay. So maybe somebody's in a car. Okay. There we go. That's a little better there. Thank you. But here at our firm, my colleagues and I, we're constantly looking for, we're investigating, and we're analyzing different strategies, different vendors, and different services to find the solutions that our clients need. Some of them are pretty good, and a number of you have been introduced to them, but many of them don't quite live up to the promises that are made. We think MyMedicalShopper is different. Most people believe that it's an important way to control healthcare costs and get better healthcare outcomes is through employee engagement. Clinically, the folks here on the call and most folks that are dealing with healthcare, clinically we know this makes sense. However, engagement requires some changes in people's behavior, and that's hard. The tools that are out there to access information on cost and quality, if you can get to them, many of them are really quite good. If you can get to them, but we know that to change people's behavior, if there's a big effort to do it, they're just not going to access it that often, or not many people are going to. For these reasons, we've decided to work with MyMedicalShopper and roll it out to our clients. So, with that in mind, we're going to go to Kate. I'm going to ask you to go to our next slide. When we talk to clients, when we talk to CFOs and CEOs, a lot of them are feeling a little bit out of control. They see their health insurance premiums rise every year or just about every year. Sometimes there's not a lot of insight on the reasons for the increase. Depending on your size, you may have some claim information that you can access, but under 100 lives in Massachusetts and in many other states, you don't have that kind of information, not actionable information. And so how do you deal with these increasing costs? A lot of people are forced to reduce coverage, increase out-of-pocket costs for employees in different ways to try to keep it still budgetable for the organization and to provide the best benefit program they can for the employees. So what do? Well, MyMedicalShopper, we think this is a strategy that employers can start to implement now that will help teach employees to be smart consumers. Most of the folks on this call and most of our clients have already gone to higher deductible plans, if not to an HSA strategy. And in all of those instances, we've talked about and they've talked about the need to increase consumerism. And we agree. But again, that's a behavioral change. And while we have the financial incentives for people to be smart consumers, giving people access to the tools in an easily accessible manner is not always been available. We think this is different with MyMedicalShopper. And we think that by using this and including some groups that are under 100 lives, you're going to see utilization trends improve. You're going to increase the value of your benefit plan, both from your employees' perspective as well as employers. And we think that this is one of the ways to improve healthcare outcomes and control. I think would be a little bit optimistic to say reduce costs, but certainly control costs, and in some instances actually reduce some of the costs that employers and employees are facing. So with that, I'm going to turn it over to Christopher, who is one of our colleagues at MyMedicalShopper. Christopher, are you with us?
Hey, Joe. Yeah, I'm here. Thanks so much for the introduction. Thanks for having us this morning. Kate, when you get a sec, you can just forgive. Yeah, exactly. The screen. I'll take over here. But I'll just kind of echo some of what Joe was saying. So we're about 4.5 years old, MyMedicalShopper. The name of our company is actually MMS Analytics, Inc. We're a big data company headquartered in Portsmouth, New Hampshire, so right here in New England. And we partner with progressive brokers, so we're super excited to be working with the Gaudreau Group. You probably take for granted being able to work with Gaudreau, but most brokers out there are pretty reactive or kind of status quo oriented. And what we look for in partners are those brokers that have a financial mindset, that think outside the box, and take a proactive approach to improving their employee health benefits for their groups. Gaudreau Group fits the bill on all those counts, and that's why we're really excited to be working with them. They obviously have been working with high deductible health plans for a long time. They have a lot of experience with them, and that lent itself to understanding the possibilities and how important consumerism is to making consumer-directed health plans really work. The fact that they have commercial lines of insurance and wealth management in-house as well probably gives them a unique perspective on employee benefits and gives them more of a financial mindset too. So all of those things really make them a partner that we're excited to be working with. We don't work with a ton of brokers. It's not just anybody out there. So like I said, we're excited to be working with Gaudreau and really happy to be on this morning. What I'm going to do is just kind of run through a handful of slides. Everybody loves a good line graph to start. I promise this is the only one I'll show, as you guys I'm sure are well aware, but I'll throw this up here and I'm going to go through just a handful of slides, and then what I'm going to focus on is giving you a live demo of what our product actually looks like, how you can interact with it, and how your employees can use it to control their out-of-pocket costs and save significantly on their health care. So this chart just kind of shows you something that we probably all intuitively are already aware of, how health insurance premiums have skyrocketed over the last decade and a half. Going on 2 decades now. Workers' contributions to their premiums have skyrocketed. At the same time, workers' earnings, so wages, and overall inflation have not kept pace. So we're all spending a lot more as companies, as individuals on health benefits. We've all been feeling this pain. I also throw this up here because our co-founder, CEO, Mark Galvin, was in the unique position of being a co-founder, CEO for 4 different venture capital-backed startup companies that he started and grew to hundreds of employees himself before he started this company. So dating back to the early 90s, when he started his first company, it was a no-brainer giving his employees really rich benefits. And in the high-tech sector that he was working in, his employees were highly skilled engineers and salespeople that he had to pry away from pretty cushy jobs in other well-established companies. He had to give them very rich benefits, and that continued with each company that he started. But he saw on his own budget and income statement this kind of effect. The chart that you're looking at in front of you, he was seeing this happening to his health benefits and making it really, really hard to start and grow his companies and give his employees great benefits. with his last company, the fourth one that he started before this one, when he was growing that one in the 05, 06, 07, 08 time frame, he moved them to a consumer-directed health plan with a maximum deductible plan, but kept his employees' out-of-pocket amount at zero by fully funding a health savings account and using a health reimbursement arrangement on top of it. He was a very early adopter on this whole consumer-directed health movement, and that was great. It dropped his premiums. His employees were satisfied because they were banking HSA dollars year over year, and yet they had growing balances. But there was one really significant pain point, which was his employees all cared how much stuff cost. Now we're in an era where almost everybody has some form of a high deductible health plan, and they're new to a lot of people. But now we're all asking the question, well, when my doctor sends me for an MRI or a blood test, we ask the question, well, how much is that going to cost now that we're the ones paying for it? And so I'm going to start with just a little story about Mark about 5 years ago. This is after he left his last company. His doctor told him that he needed a nuclear stress test. And Mark, being on a high deductible health plan with an HSA, just naturally asked, how much is that going to cost? His doctor said, I don't know, Mark, but I'll give you the CPT code. You can go and shop it. And so he called everyone he could think of. He was on an Anthem plan at the time, called Anthem. He called a bunch of medical providers. He happened to be, just from being in the startup scene, tied into a couple of other price transparency tools that were tied into some carriers. And he asked all of them how much it was going to cost for a nuclear stress test, gave him the CPT code. Anthem said, sorry, we can't tell you. Those rates are proprietary or confidential. We really can't tell you that until we actually see a bill from the provider. When he called the providers, they just pointed the finger at the insurance company and said, hey, you got to call the insurance company. We don't know how much it's going to cost until after the fact. And the price transparency companies revealed to Mark that they really didn't have access to a wide range of procedures and facilities. They had access to kind of a narrow slice of what was going on. The carriers only shared certain information with them. So Mark actually, he doesn't like taking no for an answer, and he started pushing legislation up in Concord for a while. Got bipartisan legislation sponsored by some pretty well-respected state senators and House members. And at the end of the day, AHIP, the insurance lobby and the hospital association basically said, sorry, we can't, there's a whole bunch of reasons why we can't allow price transparency in this industry. And so Mark came back and hooked up with our co-founder, Matt Robinson, and said, hey, do you want to build the gas buddy of healthcare? And Matt was all in. He's like, yeah, let's do it. So what Mark didn't realize at the time was how much costs varied from provider to provider. So this is just a snapshot of a handful of procedures in and around the Boston area, so 50-mile radius around the city. And if we look at the low-cost provider versus the high-cost provider, you'll see stunning variations in cost. And this is just due to the fact that nobody has any idea how much anything costs. We don't find out until after a bill comes weeks later after we've already had the procedure. These prices are based on the negotiated discount. So this is the negotiated reimbursement rate from your insurance company. So when you drop your Blue Cross Blue Shield medical card on the counter after going and they run that, this is what the providers are going to get paid. At one provider for a chest x-ray, you might pay $32. At another one, you might pay $323. For just a simple blood test, like a cholesterol screening, you might pay $12 at one provider or $153 at the other. And you'll see here that it's extraordinarily common to see 5 to 10x. And if I were to cherry pick the really big variation ones, which I didn't do for the purpose of this chart, you'd see a number of procedures where the variation is more than 20 times between the low cost and high cost provider. So this kind of puts into perspective how big the problem is. And this isn't just a Boston problem. If we look in New York, LA, Chicago, Houston, you'll see, 5, 10, 20 times difference between the low cost and high cost providers. So I said we're a big data company. That's the last I'm going to really focus on throwing stats and numbers at you. But suffice it to say that when you're out in the healthcare, I'll call it a marketplace in air quotes, and your doctor says, hey, I want to send you for this kind of test or this kind of procedure, it really matters a lot where they send you to how much you're going to pay. So you may pay, 1/10 what you otherwise might pay just based on luck where your doctor sends you. So not having access to this kind of information ahead of time makes it really, really tough. And if we look at this problem in aggregate across the country, we estimate that we could save close to $1 trillion, at least $850 billion annually on healthcare costs just by giving consumers access to the information they need and the tools that they need to actually shop for their medical care. This excludes things like office visits, because we don't think of those as really a shoppable event if you're going to see your primary care physician or a specialist, for instance, or certainly if you're in the back of an ambulance, any kind of emergency department visit is certainly not something that you're going to be able to shop. Putting those kinds of constraints in place, we still think we could save, close to $1 trillion a year, which goes a long way towards helping our cause. And when you consider that the whole reason that health insurance premiums are going up is because the cost of health care is going up, that's a really important point to really make sure that you're aware of. Is premiums, these health insurance companies are quasi-regulated in this industry, where they can only charge a set amount on top of actual claims for premiums. So on the small group side, they can only keep 20% of every dollar they collect in premiums. They can only keep 20% of that for overhead, administration, and profit. The other 80% has to actually pay claims. And on the large group side, over 100, it's at least 85% needs to go to pay claims. And I believe in some states it's even higher. So when you look at, well, why are my premiums going up? It's because care is getting more expensive. So what we've built is basically making medical tests and procedure price shopping as easy as a Google search. We have a massive database of actual post-adjudicated claims. So we're looking at the discount rates from every insurance company nationwide, their claims, and what people actually paid and what the insurance companies actually paid for care at each provider. We tie all this in with real-time health plan integrations. So we support over 110, maybe 120 different carrier portals nationally. So if you're on a Harvard Pilgrim plan or an Anthem plan or a Tufts plan, you as a member can connect that member portal to MyMedicalShopper to give you real-time deductible tracking, to get you really detailed information about your plan and your network and pricing, really giving you a personalized experience. And of course, MyMedicalShopper is portable across all your plans. So if you decide to go out to bid with your plan at the end of this year and switch from Tufts to Blue Cross Blue Shield of Mass, your employees don't need to learn a whole new system. It's as easy as just updating their health plan in their MMS account. And critically, everything we do is designed mobile first. So we have apps in the App Store and in the Google Play Store to bring this information to you right when you need it, whether that's right when you're in your office with your primary care physician and they say, hey, I want to send you for XYZ. You can actually access the information, influence right there where you're going to get sent for that referral, and control what you pay. Couple other things. So we recognize that employees shop and interact with our tools a lot when they are paying for the care themselves, but when they're not, they tend not to be as cautious. So when somebody else is picking up the tab, whether it's because they hit their deductible and the health plan is paying for all the claims now, or if you have a health reimbursement arrangement in place where the company is reimbursing employees for their care, we recognize that employees are far less diligent about shopping. And so what we did was design this My Medical Rewards program that allows for the employer to incentivize employees to choose lower cost options. And what we allow them to do is essentially set a reference price across all the procedures in our database. That means they pick, by default, we pick the median price, but that means that, like, if you choose median, 50% of the options are going to be low cost, 50% of them will be designated as high cost, and each of the low cost options will carry some kind of reward attached to it. And on the screen here, you can see the green My Medical Rewards banner across the bottom of the search results for those first two on the screenshot. The other thing that we allow our employers to control at the beginning of the year is what percentage of the savings do they want to share with their employees. By default, we say, split it 50-50, but you can be more generous or more aggressive with that split, and basically say, hey, if you go to an option that's $500 below the median price, we'll share 50% of the savings with you. Here's $250 that will get automatically funneled into a health reimbursement arrangement to offset future medical expenses. Or you can point it towards another tax advantage account as well. This really allows you to supercharge HRAs. If you're using HRAs now, you do suffer from, you have to pay for whatever the utilization is, and your employees tend not to be super cautious compared to when they're spending their own dollars. This allows you to actually introduce elements of consumerism into the HRA, drive down utilization, not just on that plan, but across your entire health plan, making sure that utilization doesn't just run rampant because your employees are spending someone else's money. The last thing I'm going to show you here, and I'm not going to spend too much time on it right here because it's just a screenshot doesn't do it justice, is our employer dashboard, which provides actionable analytics to our employer groups. Everything else that I've shown you to this point and described is what the employees get as a tool to help them control their out-of-pocket costs. This is what we give the employers. So whether you're in an HR leadership position, finance director, CFO, CEO, this gives you insight into what your group is experiencing as a whole in terms of claims and utilization and how it's broken down. You can look at this, and when I show it to you, you'll get a real flavor for it, for how powerful it can be for informing your strategic decision making. With that, I'm going to show you a live demo here of MyMedicalShopper, and I said everything is designed mobile first. I'm showing it to you on my MacBook Air, on my Chrome browser, just because it's bigger and easier to see on the screen. But if I kind of shrink the page, you'll see, oh, and actually, do I have to, I may have to change what I'm sharing. Hang on a sec to make sure that you guys can see that screen. Yeah, switching over to Chrome. Okay, so this is the product of the last 4.5 years of hard work, of Mark's frustration as a consumer on that nuclear stress test. Like I was just saying, is everything we do is designed mobile first, but you can see as I kind of shrink the screen down, this is essentially what it looks like on an iPhone. I'll leave it big just for the sake of everyone being able to see it easily. But the most common use case is I'm with my primary care physician, gets to the part of the appointment at my annual physical where he says, hey, Christopher, do you have any specific concerns today? And that's when I tell him, yeah, actually, my wrist has been killing me for the last month and it doesn't seem to be improving. And he looks at it and says, yeah, Chris, you got some inflammation in there. I think we should send you for a wrist x-ray and find out what's going on. At that fleeting moment, I am a motivated medical consumer, and if I have the tool in my pocket on my phone, I can pull out an app and access this information right then and there. I can influence where my doctor sends me. If I do not have access to that information right then and there, I am probably lost, right? Wherever my doctor happens to send me, whatever his whim happens to be that day or whatever his habit is, that's where I'm going, and whatever it costs is what it costs, and I'm going to be expected to pay it. I'm going to be responsible for it in a few weeks when that bill shows up. But if I can pull my phone out of my pocket, tap in the middle of the screen, start typing in the word wrist for wrist x-ray, MyMedicalShopper doesn't even need me to finish typing the word before it can guess what I'm looking for. Here it is, digital x-ray of the wrist. I tap on it. It remembers my zip code from last time, how far I'm willing to travel. I can change all of those things, and honestly, I'm not going to go 50 miles for a wrist x-ray. Let's tighten it down to 25. And here you see a bunch of low-cost options, a lot in the $40, $50, $60 range. But if I'm going to scroll down to the bottom, you'd see that I might pay as much as $309 at Portsmouth Regional or $307 at Wentworth Douglas Hospital, which is a place that I absolutely might end up. And actually, I have it sorted by procedure price here. If I switch that out to the bundled price, you'd see that actually at Wentworth Douglas Hospital, I might pay as much as $327. So again, this is reflective of the insurance negotiated discounts. We're looking at the total allowed amount, so everything that's paid to the provider, whether the insurance company is the one paying it or the employee, the patient is the one paying it. You also just heard me mention bundled pricing versus procedure pricing. We're looking at everything that gets billed alongside that wrist x-ray as well. So, we don't really care as patients if the provider bills separately for the technical component, the professional component, maybe a separate radiology associate up the street is billing the reading fee for that x-ray. We really just care about what the total cost is, and we're able to pull all of that in because of our huge data resources here at MMS and display it as a single number for the employee and give them a sense of confidence that, okay, if I go to Exeter Hospital, maybe they bill differently than Portsmouth Regional, but it's probably going to cost me an extra $50 to go to one versus the other. Price isn't the only thing that matters to a patient. It certainly isn't the only thing that matters to me when I'm shopping for anything. Price is certainly a critical component, but quality matters a heck of a lot in healthcare too. So down the right-hand side of the screen, while price is on the left, down the right-hand side, we have this thing called a Pro Score, which is our proprietary metric to give our users a level of comfort that if they go to York Hospital for a wrist x-ray, they're going to do a pretty good job. You see this Pro Score here of 100. I want to choose a place that has a reasonable price and a good score. Maybe Access Sports here is looking pretty good. Our Pro Score takes a number of factors into account, and almost everything on the site you can click on and drill down to get more information. Here you can see that, what the component scores are. The two heaviest weighted scores are how specialized is this provider at this particular procedure, and how often do they do it compared to their peers. You can even get a rough count of how many times they've done it in the last month here. So remember, you're probably doing this in consultation with your physician. You're right there in the office, and you can ask the question, hey, can you send me to Access Sports? And your doctor might say, well, actually, Anna Jakes here is great. They do an awesome job. Why don't you go there? Or they might say, yeah, absolutely. Happy to send you to Access Sports. And then when I'm ready to go, I can show all locations. MyMedicalShopper has all 8 of Access Sports, locations there. And when I'm ready to head over, I can tap right on that or facility information here. I have a phone number on my phone. This is super slick because I can just tap on it. It's going to launch my dialer. I can call, ask a question, make an appointment if I need to. I can tap right on the map when I'm actually ready to get in my car, and it'll give me turn-by-turn navigation to get over there. That's really it. I could scroll through and show you 9,000 different medical tests and procedures in here, just for the sake of completeness. I will throw up, I will finish Mark's story about his nuclear stress test. I'll tap on this, and I'm going to expand it out to 50 miles just to show the whole range here. But when Mark went back to his doctor the following year, after having failed finding results on his nuclear stress test, his doctor reminded him, "Hey, Mark, I still want to send you for a nuclear stress test." And Mark actually took his phone out of his pocket then and said, "Hey, Doc, look what we built." And he had a beta version of MyMedicalShopper on his phone. It was pretty clunky. You had to actually type in the CPT code at the time, but his doctor gave it to him. And when Mark looked it up at the time, the cheapest place, we only had data inside New Hampshire on that first beta version, and the cheapest place was Derry Imaging Center here at about $1,500. It was like $1,450 at the time. And Mark said, "Can you send me to Derry Imaging Center for that test?" And Mark's doctor couldn't believe it. He said, "Mark, the cheapest one is almost $1,500. And Mark said, "Yeah, don't send me to Catholic Medical Center down here at the bottom. It's over $5,000. And Mark's doctor couldn't believe it, that there was this much variation and that the test was that expensive in the first place. He said, "Mark, I just wanted to send you to the gym, have you do some cardio, get in a little better shape. This was not something that you needed to spend thousands of dollars on a test for. I wanted to give you a target heart rate to aim for when you go hit the gym. I have a chart behind my desk that does that for you. Here, it's like, we'll take your height, your weight, your age, and here, aim for about 150 beats a minute. Do that on the treadmill, aim for that, and you're golden." So Mark saved 100% the first time he used it, and he educated his doctor, who's actually pretty well versed in consumer-directed healthcare already at the time, but it just goes to show that he had no idea how much this stuff costs. This example also, I bring it up because it highlights how the My Medical Rewards program can work. So this is an optional add-on if you have a health reimbursement arrangement already, or a plan that you think where you'd have some cost sharing and you think that your employees could use a little extra incentive to choose lower cost options. My Medical Rewards, here you can see if I choose to go to Leahy Clinic, I might get $108 added to my account to cover future medical expenses as a reward. If I were to go to that Derry Imaging option at $1,500, I could get almost $450 added as a reward. So this is an optional add-on that you can use to really supercharge that HRA, but it's suitable for some groups and maybe not for others. So I just want to present it to you. This nuclear stress test, which is a more expensive procedure, kind of highlights how that could make a big difference. You keep your employees, you motivate your employees to stay away from some of these $3,000, $4,000, $5,000 tests by sharing some of the savings with them when they choose a lower cost option. So as I kind of described, that's how it works. You can you might have also noticed, I'd be remiss to ignore it, I did kind of touch on how we integrate with the health plan, but you see a lot of these options say in network on them above the price. There's also the $62.50 remaining in your deductible down here at the bottom. If I hit this show insurance plan details, it'll actually show you, and it's due to update any minute. I'm on a late morning schedule, but it says updated a day ago. This is where I am in my deductible right now in real time, or as of yesterday late morning. Knock on wood. I haven't used any medical care, haven't incurred any medical expenses so far this year. But this is basically a virtual copy of my Harvard Pilgrim health plan medical card. I've got my member ID. If I hover over that, I don't carry my medical card with me anymore. When I went for my flu shot over the winter, I just take my phone out of my pocket and pull it out. It tells me the network I'm on. If I need to get more granular and find out, hey, do I need a referral for this, or does my plan cover this, I can actually open up the summary of benefits and coverage document as a PDF that's pulled right out of my portal. So all of this information is available to me right on my MyMedicalShopper app, really giving me everything that I need to engage with my health plan. And like I said, we have over 100 different carrier portal integrations. So whether you're on, Anthem or any of the Blues nationwide, we have coverage. All the major carriers nationwide, Cigna, United, virtually everything. Harvard Pilgrim, Health Plans Inc. So if I'm on a Health Plans Inc. plan, I can connect it to my MyMedicalShopper account and get me that personalized information. That's essentially everything that the employees get, that we empower them with to control their out-of-pocket costs, to drive down claims and help the group overall. The last thing I'm going to show you is I showed you that brief slide, but I was pretty adamant that it's much better as a live demo than a screenshot, and that's because it's all interactive. So this is our employer dashboard, and this is actionable insights for our employers. Again, think your HR leadership, CFO, CEOs. This gives you insight into what's actually going on in your group in terms of medical claims. This is in aggregate. This level of insight is only available to groups of 50 or more. I will just highlight that because we are sensitive to risks of patient re-identification and HIPAA concerns. But for groups of 50 or more enrolled employees, we can actually show you aggregate de-identified claims for the group, sliced and diced a bunch of different ways. So this is a group of about 1,000 employees up here in New Hampshire. And this first chart, I'm just going to focus on 3 of them. I could spend hours just talking about this one thing, but I'll hit 3 charts, and I think you'll get a pretty good sense of how it works. This first chart in the upper right-hand corner that I'll focus on, this is where your employees are going. So in this particular group, I can see by size of the bubble how much volume is being incurred at each facility, and I can see by color whether my employees are spending more or less than the typical patient spends in the same geographic region. And that's on the same exact, that's in comparison to the same exact procedure mix. So if I look at Elliott Hospital as an example, I can see that my employees have incurred almost 2,200 separate claims at Elliott. And on average, they've spent almost 71% more than the typical patient has spent on the same exact procedures. If I look at Portsmouth Regional Hospital, I can see that my employees have incurred 767 claims so far this year, and on average, they've spent more than double, over 101% more than the typical patient spends on the same procedures. It's not all bad, because I can identify the facilities that are being utilized at high rates and my employees are saving. So here, Quest Diagnostics is showing me that my employees go there almost 2,100 times and on average are spending less than 53% than the typical patient spends. So at a glance, the thing that jumps out at me is how many small blue circles there are around the outside. Every one of these represents an opportunity, right? I mean, if I pick one here, like Salem Radiology, this is an example of, I picked it because it's really dark blue. My employees save almost 70% when they go there compared to the typical patient on the same exact procedures. But my employees have only gone there 27 times in the last, so far this year. They're hardly using it at all. So this is a high value but low utilization provider. If I'm trying to focus on, okay, what do I spend my time and energy on? If I'm trying to identify the things that I can do as an HR manager and figure out, okay, where do I want to spend my time, my energy? What do I want to do? It might be handpicking some of these low cost, low utilization providers and making my employees aware of them. What are their hours? How to ask for a referral there, make them aware that the employees that go there save a lot. And they should be meeting that with, they should be pretty receptive to that message because they are paying for a lot of their medical costs and you're helping them do that. The chart below here is showing us where my employees are spending their money in terms of procedures. So these are the common procedures that have happened in the group. And you can see that, from lipid panel to this glycosylated hemoglobin test, there may be a lot of lab tests that show up on this chart, and that would inform my decision making. Okay, maybe I should focus on LabCorp and Quest and where their locations are, and make sure my employees know how to ask for a referral, where, what their hours are. This one test, as an example, if I were to go and type in glycosylated hemoglobin test on the shopping tool again, if I were to go back and just type that in and see what the range of costs are, I'd see that this one procedure ranges from like $10 to $85, right in a tight little geography. And my employees, based on 288 records so far this year, are probably overspending by thousands of dollars on this one procedure. So you can imagine what kind of effect you can have by educating your employees about, LabCorp in this particular group, or Quest, and what kind of effect that might have on your total group in terms of claims. If it's emergency department visits that are jumping out, like these ones are here, this group spends way more on ER visits, per case, than the typical patient spends. Maybe it's time to get urgent care involved and have them, send one of their marketing people in to do a lunch and learn and make sure that they know what kinds of care they excel at, what their hours are, when to use them, those sorts of things. Last thing I'll focus on is just you can actually see on a week-by-week basis where you stand in terms of your aggregate claims and how that compares to your expected trend in the gray shaded area behind it. So you can actually see, okay, are we trending high because of high-cost claimants in this chart above it? Are we trending high because of something systemic? I can look at the charts and say, hey, we spend more than other groups in the area on things. Like, why is that? Worst case scenario, I have access to this information for budgeting purposes. So I'm not going to be surprised when I find out, what my insurance company reports as my MLR at the end of the year, close to renewal. If I'm trending high, I'm going to know that ahead of time, and I can start planning for it. If I'm trending high and it's something systemic in the group, I can take some action mid-year to educate my employees and try to drive more engagement with the tools. And that just kind of dovetails in with MyMedicalShopper in general. We have a whole customer success team devoted to engagement with our tools, which is why we have by far orders of magnitude greater engagement than any other tools out there. On average, we see in the first year between 50 and 70% of employees using our tools to actually shop and choose low-cost care. And that is really the key. That all this stuff, as Joe was kind of pointing out at the beginning, is access to information is great, but if the employees don't engage with it or aren't empowered to actually use it and inform their decision making, it really doesn't matter. So we really focus on making sure that employees have this information in a way that they can interact with it, in a way that they can use it to their benefit. And our team is devoted to driving maximum engagement that whole time, looking for, on average, between 10 times and 20 times the estimated savings compared to what we collect in license fees for our tools. So that is probably about it for what I wanted to show today. I really appreciate your time. I think we have a few minutes to take some questions. I'll toss it back to Joe and the team over at Gaudreau. But thanks so much. If you have questions, we'll stick on for a few minutes and answer them.
Great, Christopher. Thank you so much. That was awesome. And we want to open this up to some questions now. We're respectful of people's time, and so if the questions spill over or if we need to set up a follow-up meeting with clients, we'd be happy to do that. But somebody, okay, all right, put them back on mute.
Yeah, that's
thank you.
funny.
Whoever just did that, thank you.
Oh, that's good. They're still there.
Yep. So when we saw this one, this rolled out to us, I was very, very excited because this does so much of what our clients want to do from the feedback that we get in terms of really empowering their clients to make the right healthcare decisions, not just for cost, but for quality measures as well. And this is a way that we can do this. I went to my own primary care physician and showed it to him because we at the Gaudreau group, we're enrolled in this now. We're using this program. And I said to him, if you were going to send me for a test, where would you send me and how much does it cost? And he started getting a little agitated. He's saying, people are asking me more and more for this stuff. What do they expect from us? We don't have access to this information. And I pulled out my phone and I said, what if you had this? And he looked and said, oh my gosh, that's incredible. So I think my primary care physician is going to go on MyMedicalShopper, not just for himself and for his employees, but for his patients as well, asking these kinds of questions. So and when we talk with different people, different vendors and things, and they have all this stuff and it looks amazing and it's great like this, I don't believe anyone out there is really all that interested in how much it costs, right? Okay. The cost for MyMedicalShopper without the employer analytics piece is $5 per employee per month, $60 per year. I know most people out there don't have a single healthcare plan for an individual that's much less than $500 or is probably more than $500 a month. So we're talking about literally less than 1% of healthcare spend for you and your employees to have this sort of information, this sort of power. And when we can start identifying the providers and that are doing the quality work at low cost price, you can see what that's going to do to your healthcare spend. So it does cost something. Nothing of value is free, but at $5 per employee per month, we think it's an extremely valuable service. If you want the employer analytics, and again, you have to have at least 50 employees on the plan in order to do that, it is, Christopher, if I recall, $1.67 additional. So that,
that's right.
There's a little bit more, but the power that it provides you and how you can steer people is incredible. So, other than the person that's in a wind tunnel, is there anyone who has questions that they'd like to put up? None. No questions. Okay, well, here are a couple. When we've talked with other folks and that are in this, they ask some really good questions, such as, well, where are you getting this data? And MyMedicalShopper gets it from all payer data systems that are required in each of the different states. And what we think is really key is this is information from post-adjudicated claims. This isn't what the provider charges, the gross charge. This is the net charge. So we're talking about real numbers like that. The second question that comes up, Christopher showed how you can use the My Medical Rewards program. You can put an incentive in your HRA or your HSA in terms of giving people incentive money to go to lower cost providers. And there are a variety of ways you can do it, and he referenced it as supercharging your HRA or HSA, and we think it is, but know that is not a required program. And maybe we start off without it, but it's there if people want to do it. It's not a requirement. We just got a question that came in. Can the rewards go to the HSA or does it have to be an HRA? It can go to either. It can go to either. So you've got that kind of flexibility in terms of the rewards. Thank you for that question. Other questions? Let's see. A couple of the things that Christopher also referenced. This is portable. This is a separate vendor that you'd be contracting with. And should you decide to change carriers, you change from carrier A to carrier B, your employees and you would still have access to MyMedicalShopper. It's not really carrier dependent. In fact, it's absolutely not carrier dependent. And I think that's part of the power that it brings. And a lot of folks get surprises as to what's coming up for the renewal. Most of the carriers aren't that good about providing information. Particularly in the 50 to 100, they're very, very reluctant to do it, and it's hard for employers to project what they might expect at the renewal. But if you're enrolled with MyMedicalShopper and you have the employer analytics, you're going to be able to see exactly what's happening in your group in terms of utilization. Are you on target or not? Is your plan running hot or is it running well? And that information we'll be using when we're negotiating with carriers at the renewal. Okay. Christopher, anything else you might want to add?
I guess I'd just hammer home that dependents do get their own accounts. So, like adult dependent spouses, they get their own at no additional charge. So they can log in separately, connect their health plan separately. It's a per employee per month subscription. So that definitely we get that question. I want to make that clear. Otherwise, I think you hit a bunch of stuff. If anybody has any other questions, we're happy to, I'm sure Joe would be happy to follow up with you personally, and we're happy to support that. If anybody has any additional questions that they think of right after we hang up, it's always, you have that aha moment, like, oh, what about this? We're here. So please don't be shy about asking questions after the fact.
Right. And just to, again, we're available for any questions, including after, but just to kind of wrap, we have looked at and we constantly look for ways that we can improve the experience for our employers and their employees. And we've vetted a lot of organizations. We don't see anyone doing anything like what MyMedicalShopper is doing, and that they can do it in such a cost-effective manner. With the breadth of care that's available, over 9,000 different medical tests and procedures are in their database, and it's growing every day. Through artificial intelligence, they're gaining more and more information on this, and as it starts going out, it's relatively new, but as it continues to go, it's going to get more and more powerful. Very easy to use, right on your phone, the way most people are accessing information right now. And if we want people to really change their behavior, we have to make it as simple as possible. We can, depending on what you want to do, you can integrate it with a rewards program. And so many of our clients talk about the fact that once the deductible is met, that people don't have as much of a sense of controlling costs. With MyMedicalShopper and with the incentives you can build in to continue to use low-cost providers after the deductible has met, it becomes an incredibly powerful tool to do that post-deductible. And with all that, we're really, really pleased to be able to roll this out to our clients.